Hello, I'm Barbara Gibbon from the College of Nursing at Michigan State University. I want to welcome everybody to the Oncology Nursing News Peer Perspective. This program will focus on important issues around oncology nursing that face us today. The topics that we will cover include cancer survivorship, symptom management, palliative care, and pain management. I am pleased to introduce our esteemed panelists who will engage in discussion and share their insights about these important topics. First, we have Janine Overcash, Associate Clinical Professor at the College of Nursing at Ohio State University. Next, Helen Foley, Clinical Faculty of the Adult Gerontology, Oncology, Palliative Care, MSN program at Case Western. Ruth McCorkle, the first Florence Wall Professor at Yale University, and Becky Kronk, Assistant Professor at Duquesne University School of Nursing. Now let's begin.
In the area of symptom management, I think that nurses are key to what happens to patients across this. The value of nursing in this is so important and becoming increasingly important as the treatment becomes more complex. And as our healthcare system has no idea how we're going to be coordinated and how the care is going to be coordinated. But despite that, nursing is key to the success of the patients and the outcome and the family involvement in helping the patients. Nurses work across the care continuum, nurses work across the settings, nurses work with the patients and families directly and directly on a long term for symptom management. In such, we have to continue evolving, and we'll talk about that in a minute, to really understand what's happening and to provide strategies for the patients. It is not okay for the patients to continue to have symptoms and say in their treatment, well, that's cancer treatment, so of course you expect symptoms. In our work, we find that no matter what stage we identify patients in the phases of treatment, nor what treatment, there are many unmanaged symptoms that patients have. So nurses have to continue to understand the mechanism of the symptoms, especially as treatment changes. In our current phase, that means the oral agents who have new side effects and new symptoms that occur. We will have to change our role as there's less chemotherapy. I understand there are 200 pipeline drugs and 40% of those are oral agents. And so what will be the new standards, the new guidelines to go forth? And nurses have to gain new knowledge as we go forth with that, but then we also have to figure out how we're going to engage the family because their responsibility will increase, but primarily more responsibility falls upon the patient because they're managing these things at home. Having set the stage for that, Ruth, what do you think the future is going to look like for nurses in symptom management?
Well, one of the challenges in the role of the nurse, in our place we have disease-specific clinics. We have 12 of them. So the nurses in those clinics, whether it's lung, breast, there is a body of knowledge and a body of evidence base that they're somewhat able to get their minds around and understand what might work for one symptom over another.